Hello, my name is Laura Sherrick Kent Hemloff. This is about my model health voucher system. Merge welfare and health budgets into a single disability treatment voucher allowance. Citizens would also receive nutrition ration and first child and marriage new home construction grant or housing rent allowance. Each deprived citizen would receive vouchers for private medical specialist treatment worth $400 per week minus 0.2% of assets per week and 10% of income. A benefit withdrawal taper rate reduction from over 90% under the old income tax. Income testing, disability testing, bans on work and waiting periods to 10% would encourage work, while also providing security. Disability voucher would not be a payment, not to work, but an incentive to get work ready. Paid into the disabled person's healthcare savings account provided by an insurer. Used to buy insurance for treatment of pre-existing and emerging illnesses. 90% of the cost of private specialist treatment would be paid for by the insurer. The patient would pay 10% of the cost as a copayment of disability vouchers from the patient's health voucher savings account. The copayment would have disabled patients' moderate demand away from most expensive low-value treatments in favor of specialists providing maximum product quality for minimum expense. This may include the best filling for the minimum cost dentist. Treatments would be limited when reaching a cost of 10 times the value of premiums paid by the citizen in the last year. Insurer would be paid 20% of insurance payouts to encourage insurer to make larger payouts, and to pay for health information systems. Patients as health product consumers would refer to online reports and wiki treatment guide from other patients, and medical product web page from insurer listing specialist health product details and pricing. The patient could also make a free call to their insurer's telehealth direct call center for extra advice, and to ask for a treatment assessment consultation. The insurer would offer and recommend from a range of highest quality private specialists competing on healthcare product quality and price. Once the patient chooses a covered treatment, the insurer would telelink through referral and appointment information to the appropriate private specialist. After each treatment, patients would be required to fill in an online report about the treatment experience, to guide other healthcare consumers, much like eBay. Covered health specialist would have to provide good value for money health products to retain insurer accreditation. Making indemnity insurance illegal would also focus specialist doctor duty of care. This would reduce costs for good doctors, and make bad doctors pay for own mistakes. Patients with time to do own research about their ailment would be vastly more knowledgeable about possible cheap complementary treatments for their particular ailment than general practitioners. Patients could quickly use real-life experience to test a range of complementary and nutritional treatments to solve own complex health problems. Some expensive treatments do work, but more life would be saved under health voucher choice of cheaper remedies than would die earlier from termination of GP-controlled super-expensive treatment misadventure. Any person having suffered an ailment who is in remission, who has experience of treatments as a patient, and is healthy, and has training qualifications paid for from a 10% trading levy on private revenue, and who has accreditation from an insurer should be authorized to be a specialist for the insurer for treatment of the particular ailment they suffered. Because half of health voucher would be saved, voucher budgets could be 2 times over-allocated, so provide more vouchers to disabled citizens in real need. Children's health care would be paid for from 10% levy on corporate revenue to sponsor children's boarding school health care. Compulsory mental health if required, would be paid for from a 10% emergency services levy on corporate revenue. Aged and disability homes and hospitals for care not treatment would be paid for from 10% of the national budget and then privatized. Thank you very much.